Welcome back to Her Wellness Diary, a space where we have honest, gentle, and empowering conversations about women's health, hormones, healing, and becoming our highest selves. If you're a woman who wants to feel informed, supported, and deeply connected to her body, you're in the right place. Today's conversation is one that more women need to hear, and I'm so glad you're here for it. Let's talk about something women whisper about but rarely prepare for: postpartum recovery. Not the baby clothes, not the nursery, not the birth plan, but your body, your healing, your feminine care. Because after birth, whether you had a vaginal delivery or a cesarean section, your body goes through one of the most intense transitions of your life, physically, hormonally, and emotionally. And you deserve to be cared for just as much as your baby. First, let's normalize what's happening. After delivery, your body begins shedding the uterine lining. This bleeding is called lochia, and it can last up to 4 to 6 weeks. You may experience swelling, tenderness, stitches, if you had tearing or an episiotomy, hemorrhoids, pelvic floor weakness, hormonal crashes, and vaginal dryness. If you had a cesarean section, you are also healing from major abdominal surgery. This isn't minor, this is deep recovery. Your body is asking for time, attention, and compassion. Now let's talk about nurturing your body gently during this time. First, prioritize hygiene softly. Use warm water rinses with a peri bottle after using the restroom. Pat dry instead of wiping aggressively. And choose fragrance-free pads and breathable cotton underwear. Your tissues are sensitive, so treat them like delicate skin. Next, support healing. Cold compresses or witch hazel pads can soothe swelling, while sitz baths with warm water can promote comfort. Always follow your provider's guidance for stitches. There's no rushing, no pressure, just gentle, gradual care. Protect your pelvic floor, even if you feel fine. Your pelvic floor has been stretched, so avoid heavy lifting, ask about pelvic floor therapy, and practice gentle breathing exercises to reconnect with your core. This is long-term care, not a quick fix. Finally, address hormonal shifts. Postpartum hormones drop dramatically, so you may notice mood swings, night sweats, hair shedding, and vaginal dryness. This is common, but if sadness feels overwhelming or persistent, reach out for support. Postpartum depression is real and treatable. One of the quietest conversations is about intimacy after birth. Doctors often say to wait 6 weeks, but emotional readiness matters just as much as physical clearance. Dryness is common, desire may change, and your body may feel unfamiliar. Give yourself permission to move slowly. Your femininity hasn't disappeared. It has evolved. Honor your emotions and communicate openly with your partner about your needs. Here's what I wish more women were told. Postpartum is not a bounce-back season. It's a becoming. Your body carried life. Your hormones are recalibrating. Your identity is expanding. Gentle care is not a luxury. It's a necessity. Eat nourishing meals, rest when possible, and accept help without guilt. Healing is not weakness, it's wisdom, and it's a powerful act of self-love. If you are postpartum right now, or preparing for it, I want you to remember, you deserve softness, you deserve patience, and you deserve care. Your body is not broken. It is healing, and healing deserves time. This is Her Wellness Diary, where we choose growth, peace, and power every single day. Subscribe for more conversations about women's health, hormone balance, and nurturing your highest self.